Hello, hello everybody. This is Wanayran Alvarez Moving Cultures, greeting you from Bangkok, Thailand. Good morning, good afternoon, or good evening, depending where in the world you are at the moment. Today we have a very exciting guest. She is a very powerful woman who has been engaged into mental health world and issues. She is the founder of Dementia Alzheimer Organization Kenya, and I had the great pleasure to meet and to be in contact with her during my time living in Nairobi. And we also have the opportunity to partner in a couple functions and projects. So let's welcome Elizabeth Mutunga. How are you, Elizabeth?
I'm fine, thank you. Thank you for having me in your show.
Thank you, Elizabeth, for accepting the invitation. We are very, very happy that you are going to share with us your life, your journey, and all the amazing activities that are coming for the future, because you are a very optimistic person and you still very much engaged into your community. So please tell us how and why do you decided to be into the mental health world and field?
All right. At the age of 17 years, my dad developed dementia. Dementia is a condition that one's personality and behavior changes, and he had Alzheimer's disease. And before I understood what it is, it took us 17 years as a family to get help and to get the answers 15 years to get the answers that we require. And by the time, that was in 2005, and by 2009, my dad rested, so he had the condition for 17 years. So that is why I decided to go into this space, so that to be able to help other caregivers who have loved ones exhibiting dementia-like symptoms and they don't understand what to do with their loved ones.
Elizabeth, how was your journey dealing with your father's illness?
It was quite difficult because my dad was a very loving person. My dad was a policeman by profession, and he loved, just after work, he would come still in his uniform, sit down and read for you all the storybooks, Little Princess and the Seven Dwarfs. He would read for you Cinderella. He would read for you Chicken Licken, all those nice storybooks. And he was my friend. And it was sad that now, after he first developed diabetes and went into a diabetic coma, then after that he had to be retrenched due to medical health, and then so he went home, and he could not deal very well with being a civilian, and then he just changed. He became violent. He became very abusive verbally. He would beat you anytime, and that's not the daddy I knew. And so for me, it was quite shocking. And then the other thing, he moved us from a 4-bedroom maisonette house to an iron sheet that is like a 5-roomed house round the corner. And he was a smart dresser. Then he started putting on pajamas on top of his clothes. Then he started selling the tiny parts. He sells the tires alone, the rest of the vehicle alone. That's when we realized there's a problem. And so that it was very disturbing, because you couldn't even tell him anything because he was not listening. But now when I look in the hindsight, is because we didn't know what it was. And so we were trying to help him, but maybe we were giving the wrong help then.
How old was he when he started to develop the illness?
He must have been in his late 60s going to 70. Okay. Because after he was retrenched on medical grounds, he still worked for another 10 years before we noticed these changes.
Did he manage to get a diagnostic on the illness?
We got a diagnosis 15 years later, and he passed on the 17th year.
Oh my God. So you actually went through the whole process without knowing that he was an Alzheimer patient?
Yes.
So was that one of the reasons you started and created the Dementia Alzheimer organization, to support other caretakers and families?
Yes, that is one of the reasons, because I thought about, if it took us 15 years to get help, and to understand what you're dealing with. I wouldn't want anybody else to go through that. So a lot of times, so now with the organization, we've got like helplines where people call when maybe if they have just been told their loved one has dementia, or if they start seeing symptoms, and then we advise them, go and see a doctor, and which kind of doctor to see, because for us, we don't know where to start. So that is why we are using this platform to help somebody else make their life easier so that they don't go through that long process of trying to get information.
When you talk about the right type of doctor, what is the channel to understand and to go to the right place?
So we advise families to start with a neurologist. A neurologist is a brain doctor. So he will run tests. He'll be able to give you the diagnosis. And also a lot of people come to me and tell me, my father or my mother or my sister has dementia. And then I ask what type of dementia it is. They don't know. So that is why we ask people, go and see a neurologist so that they tell you what type of dementia it is, because that helps you give your loved one better care when you know what type of dementia it is.
And how many types of dementia exist?
About 7 of them, but there are many more. There's HIV-related dementia. There's multiple dementia, where it's actually mixed dementia, where you can have either Parkinsonism together with Alzheimer's. There's Alzheimer's disease. There's Jacob-Crawford disease. There is Parkinsonism. There's Alzheimer's, which is the most common. And then there's Lewy body and frontotemporal dementia, but there are many others. Those are the ones that are known.
Are the new type of dementia rising with the time, or they are actually discovering there is different behavior within the patients with these levels of dementia?
I think now with more information out there, a lot of people now are noticing it earlier, because a lot of people think this is an old person's disease, but we've had cases of people who are in their 40s who start developing dementia. So I think there's a lot of now information out there. And when people start seeing, for example, signs and symptoms such as repetitive behavior, forgetting, just that you just had a conversation and they cannot recall that you had that kind of a conversation, or they are wandering away and they're not able to come back home. Small things, then people start noticing there's a problem, so it needs to be addressed. So I think there's more, with more awareness, more people are coming out to ensure that we are not getting calls when people have really progressed. We are getting people when they are still in the early stages, and then that helps us put systems in place, or help the family put systems in place to support their loved ones.
Elizabeth, are you also working very close to the medical sector of Kenya? Because some of them, even general doctors especially, are not very aware how to deal with dementia and Alzheimer issues.
That is correct. So we are working with the Ministry of Health, ensuring that also we have systems and a dementia plan in place so that we are able to address the issues of dementia. We have been conducting training for medical personnel so that they can also understand, especially nurses. Sometimes when people come to hospital, especially the people living with dementia, most people think they are being difficult or they're just refusing to do stuff. So we are trying to tell them, no, they're not being difficult, they are unwell, and it's not that they are refusing to do what you want to tell them. So we are working with the medical fraternity to educate them more about what, even the physicians, the general kind of doctors, so that they understand what dementia is.
Yeah, dementia and Alzheimer is a very taboo topic. How are you dealing with that?
So that's very true, because a lot of times it's very stigmatized. A lot of people, like my dad was from a community called the Kamba community. Now in Kenya, the Kamba community are believed to be involved with witchcraft, and
Okay, we are waiting for Elizabeth to come back because we are having some issues with her internet. And in the meantime, we're going to recall once more how important is to understand and get an early diagnosis of this illness that is very silent and sometimes can be misinterpreted. And this is what Elizabeth was sharing with us. She was telling us how the situation can be controlled if we have an early. Yes, thank you, Elizabeth. I was just repeating a little bit of the information you shared with us. That is so important for everyone to have an early diagnosis, and also to have very close attention to small issues on the change of behavior and memory, and also the way you deal with life, and be alert in order to get a preventive and also early attention. You were telling us about the Canva community.
Yes. So the Kamba community and another community called the Kisii, a lot of people think that the elderly people are involved in witchcraft. So even, especially in the Kisii community, they end up banning the elderly people because they feel they are going to bewitch them. Now, my dad was from the Kamba community, and a lot of people would say either we have been bewitched, or other people would say it's because we have done something wrong to the gods. That's why we are being punished. So it is a very taboo subject. And that is one of the things that we are trying to advise caregivers to come out in the open and speak about what they are going through. Because when you speak out, you stop stigmatizing the condition. Because if you keep quiet, then you don't give us information and nobody can come out and help you. So it's something that we are trying to do. So we create awareness. We go to communities and speak about it. We ask people to invite us in their communities so that we are able to create more awareness.
Elizabeth, are these practices of aggression against people with mental health issues still taking place?
Yes, it takes place.
Yeah.
Especially people who have dementia or any other kind of mental illness, you will find in most cases they are locked in their houses, or tied to a tree, because you're scared. And we understand why the caregivers are doing that, but it's not humane, because they end up tying them because they are scared they will walk out and they will never find them. So they think by tying them there that they're they're doing the right thing. But we are advising people, no, have somebody who follows them, who walks beside them, who takes them for the walk, so that you can bring them back home instead of tying them onto a tree or trying to close them up in the houses, because also that affects them more and they deteriorate further when they feel they have space to do what they need to do.
But do the people still believe that they are spiritually damaged?
There is that also, because like I said, they believe that you have done something wrong to the gods, so you're getting punished. And so this is the one having a mental illness is because you're being punished, which is not true. Anybody can be mentally ill. It's a condition that will come, and it's not that you ask for it, it just comes. So people need to know that you can't, and a lot of people even take their loved ones for exorcism, trying to have the spirits removed from them and all that. But you're really putting this person who's going through this journey through a lot of stress. So people need to understand that it's a condition like any other. And that is why, even as much as we are working with the neurologist, we work with the psychiatrists too, to help the family, the person living with dementia, get the support that they require mentally.
How do you marry the traditional medicine, the Western science, and therapy? How do you work with that?
So, of course, especially in the villages, the traditional healers are revered and people really believe in them. So you cannot sit down and say you cannot go and see a traditional herbalist. So they believe they need to go and see a traditional herbalist. That is their call. So you just you give them the facts and let them make their own choice. Therapy also, because even as they see the traditional therapist, then we still have a support group where we meet as caregivers and we support each other for therapy and we assist each other. If they call us and they want a counselor, we will hook them up with a counselor too. So all these need to be married, because that is why even we are working with some of the traditional healers to understand what dementia is, so that they don't think it's something you're being punished or it's
there is something
wrong.
negative. Yeah.
Yes, You see, a lot of times people living with dementia forget the current information. So they remember things that happened in the past. So they might start talking about people even who have already died, who are no longer alive, and they are talking to them like they're there. So we are telling people, if you believe you want to take your loved one to the traditional herbalist, take them there. But also remember, it is dementia, and these are the symptoms that you shall see. But we give them the information and let them make an informed decision.
Yeah, it's been over a decade that you've been working with dementia and Alzheimer patients, right?
Yes.
Has you seen like an evolution in the community and how they deal with the illness?
I have seen a change. Initially, a lot of people would not visit families, including even our home. A lot of people would not come to visit us because they were scared that whatever my dad had, they could get. But now I see people going to visit homes. And one of the things, there's a gentleman, I went to visit a home somewhere in one of the rural areas. And he, after I had spoken to the family about dementia, he said, you know, you said there is no cure for this disease, but I think there is a cure. So I asked him, and so what is the cure? And he said, love. Love is the cure. So I am seeing a revolution, there's a change. And I use his phrase all the time. I say, yes, there's no cure, but love is the cure. When you go visit them, sit down with them, sing with them, dance with them, I mean, it makes a total difference in their lives. So it's just amazing to see the transformation.
You just mentioned singing and dancing. How have you been dealing with the expressive therapist? Who is in your team now supporting you at that level?
So we organized an Alzheimer's cafe where we as the caregivers, we brought in musicians, and then we brought in music for the 60s where they could remember that kind of music.
Exactly.
And then we did art therapy with them. I remember when I first met you, I was having an art therapy class. So
exactly.
We did therapy with them. And then one of the ladies, as she was doing her art therapy, she asked me, what color is this I'm holding? Because I think she couldn't see clearly. So I said, it's color red. And she remembered the song, Lady in Red. And she started singing and she was coloring. Amazing. It was so amazing to just watch her and see her expression. So having that, it was amazing. So we keep trying to do that. But now with COVID, now we can no longer do that because our plan was to have a center where they would come like once a week and then we'd have all these activities, singing, dancing. But it makes a big difference for them, especially when you put for them the music that they can connect with.
Are you leading online workshops for the patients at the moment, or you have not started?
We are doing online.
You're doing online.
Things are now being done online, yes, and hoping that as soon as things settle a little bit, because we had just had our third wave of COVID, once that settles, maybe we may end up opening up again, but at the moment, everything is being done online.
How many members do you have in your organization?
We have, like, on the wall, the Telegram wall, there are about almost 300, but I know there are many others. We have followers on Facebook, others followers on Instagram. So everybody, it depends on the social media they want to follow. But we have a number of people now, and people are actually coming out, and you write an article and somebody writes to you and says, hey, my mother has dementia. Hey, I need more information about this. So at the moment, those are the numbers. Like Instagram, I think we have about 30 something or so. Facebook, we have over 2,000. So it depends on the
platforms. Yes. Elizabeth, why purple? I decided also to wear purple because I remember when we met, you shared with me that purple was the color of the Dementia and Alzheimer organization. Why purple?
Purple is royal, and we want to treat our loved ones with the dignity that they deserve. A lot of times we forget that there are people behind the disease. So that is one thing we want to remind people all the time. Their dignity matters. They are royal people. Even if they can't speak right at the moment, they're still here. So purple is very important because it brings out, you know, the dignity and just the royalty of these people we are dealing with.
I know that you also have traveled overseas with this message of health, love, and transformation. Can you share with us some of your experiences working with colleagues and partners from other countries?
It's been amusing because we thought being in a, for lack of a better word, we're in the third world country, or developing country rather. We thought that our problems are unique. But once we speak to other, even the developing countries, they tell us we are still where you are at. Stigma is still rife. People still, the issues of dementia, even in the governments, it's still not something that is really embraced. So people, a lot of people, it's the same message that we have. And so we have to unite together to ensure that our issues are listened to, our issues are addressed, because it is something that, you know, and the other sad part of it is most countries don't have data on issues of dementia, for example, especially in the middle-income countries, because a lot of people will not go to hospital, they'll go with another condition, not dementia. And so it's one of the things that we are working with. So we are using we are doing a research with London School of Economics and Africa Mental Health, and we are working on a project called STRIDE. STRIDE means strengthening dementia awareness in developing countries, and we're trying to come up with data, to come up with an anti-stigma toolkit. And so we are in the middle of, we have 7 countries that are part of this, and in Africa, it's South Africa and Kenya who are in this program. So this helps us talk to each other, address issues. You think in Kenya we have unique issues. It's the same also in South Africa when you speak to them. Sometimes they may be 2 steps ahead of you, so you learn from them and also tweak it so that it can suit you. So it's amazing to just learn from the other countries.
So you talk about unity. There is a union of international Alzheimer and dementia organizations, global.
Yes.
And what is the name of the alliance?
Alzheimer's Disease International.
Okay. And
yes, it is based in the UK.
And how people can access to this kind of organizations?
Actually, when you Google Alzheimer's Disease International, you will see they have a map, and they have in each country they have a member representative. And if there's no, in your country there is no member representative, and you'd like to start the organization because you have a passion for people dealing with dementia, you could always approach them, and you can be able to, they will help you with the training on how to start a chapter and how to ensure that you are developed in your country, so that as we have very many people in each country, our tentacles are being spread, and we're able to send a better and more unified message.
I think this is the right moment to talk about how to go about the foundation and the creation of an organization like you did, because this was your initiative. You are the founder, you are the CEO. Will you let people know how and which steps you followed in order to create it?
Okay, so like I mentioned, I contacted Alzheimer's Disease International. I went to London for a training. It was a 1-week course, and they take you through how to set up, how to fundraise, how to set up a board. There's a whole structure of the training. And then after that, you write your goals for 5 years. I mean, for the 1 year when you go back home, and then they follow you and find out. Like I wrote, I will have to set up a board members. I will set up an organization. This is what I'm going to do. So you state what you're going to do, 5 goals. So they follow you and they ensure that your 5 goals are set. Once you meet the 5 goals and they are set, then there will be a meeting by the Alzheimer's Disease International together with the membership committee, where they will present your organization and the things that you have done. And then they decide, do we want them to become members or not? If it is a yes, then you become a member. If it is a no, you're told the changes that you need to make, and then you can become a member. So that is what happened with us. We set up everything that we had decided to set up. We looked for funding because we didn't have money. We were starting from our pockets. So we looked for some money so that at least you look liquid and that you can run the organization. And so then we became members. So ADI is very helpful, and they're always training us on how to better our organizations and our associations as members of ADI.
Yeah, this means that as a private person, you usually start with your own resources, because for you it's like a mission. It was like a part of your life to create a center that can actually support victims of this illness, because we have to say they're victims, the families and the patients as well, and any other person who gets close to this situation. Tell me more about the financial situation dealing with an organization like Alzheimer Dementia.
It can be very tricky, because sometimes also people who reach out to you, being caregivers and caregiving being very costly, sometimes they want money or they need more help. Sometimes you may not have the money that you can support them with. But the good thing is when you're working with other partners, then, for example, if maybe it's diapers that they require, then you'll get somebody to donate the diapers. So it means that you have to go out of your comfort zone and make allies with other people so that they can support you and make you meet your goal as an organization. So having allies is very important.
Yes, partnership and collaborations. I think this is the word. At the moment that you can get to the community and you can get volunteers who can join, and you can have people who have resources and also is aligned with your vision. You can get some of the materials and the resources to go on. So we are getting close to the end of the 30 minutes with Elizabeth Mutunga, founder and CEO of Dementia Alzheimer Organization, Kenya. Elizabeth, what is your message to the world?
My message to the world is, let's have more dementia-friendly communities. If we notice somebody has an issue, let's not just assume they are pretending, let's help. Sometimes they may look very confused, but just taking a minute for them, how we make them feel matters a lot for them. So let us have dementia-friendly communities where we watch out for each other, especially now with COVID. It's really lonely. So it's best that we be each other's keepers.
Remember, purple is a color of royalty and dignity, to care and love the people around us who is dealing with dementia and Alzheimer issues. Once again, Elizabeth, thank you so much for all the work you are doing. Blessings. And this is Mueke Angerer, Moving Cultures and Cultural Stopovers, Women of the World Talk and Act Global. In an hour and a half, we're going to have our second guest of the day, Amy Napawan, classical pianist from Thailand, who is also a mentor, an educator, and a passionate woman connected to arts and culture. Thank you for promoting unity and diversity, Elizabeth, and please keep shining. Take care. See you.
Bye.
Bye-bye.
Bye.